We start, though, with a closer look at the role Moderna is playing in Canada's vaccination program. The federal government has ordered 40 million doses of the Moderna vaccine, and so far, more than 4 million of them have been delivered. 1 million doses came into Canada last week, but there's no scheduled date for the next shipment. The company, though, initially promised to deliver 12.3 million doses between April and June. Given the uneven deliveries, it's unclear whether that target will be met. In Ontario, though, Moderna is now being given out at pharmacies in designated hotspots. Andrea Carfi is Moderna's vice president and the head of research for infectious disease, and he joins us from Cambridge, Massachusetts. Mr. Carfi, thank you very much for joining the program tonight. Much appreciate your time. And I want to begin talking about variants. A lot of concern about them worldwide. From what you know now, how well does the Moderna shot work against the variants that are out there?
Yeah, so we have evaluated the vaccine or sera from subjects that have received the vaccine on different variants. And in general, we see that the level of neutralizing antibodies are still what we think to be protective. However, we see for some variants a decrease in the potency of the neutralizing responses, especially against the variant that was identified first in South Africa. So we think it's protective, but there is a decline or decrease in the level of neutralization.
So it works, it's still effective, it's just not quite as effective. But, I know you are working on this experimental new vaccine candidate and see it as a booster shot. Can you walk me through how that would potentially work, knowing that Canadians could end up with that Moderna booster in their arms?
Yes. So first thing, let me say that we think, again, that the current vaccine is protective. But what can happen is that the duration of protection might be shorter for certain variants compared to the original virus, just because we start from levels of neutralizing antibodies that are lower. Then what we have seen looking at these responses in subjects that have received the vaccine is that after 6 months, the neutralizing responses are still measurable and strong against the current virus. But for some of the variants, especially the variant from South Africa, actually in some subjects we are below the limit of quantification, meaning we cannot quantify the neutralizing responses. So those subjects are higher risk, let's say, of being reinfected if the new variant had to come, to spread around.
So that's why you would want this booster shot, I guess.
Exactly. So that's what we are doing, is basically evaluating how a third dose, a booster dose, may impact immunoresponses. And so we have a clinical study that is ongoing, where we basically are testing either a third dose of the current vaccine, just because again it's a boost, so it should increase the neutralizing responses. And then the other part of it is that we are basically testing a version that has the sequence of the variant that was identified in South Africa, and so to have more specific immunity against this variant. We finally are also testing a combination, so a vaccine that is a 50-50, the sequence of the old virus and the 50, of the new one. So we will have data for that one as well. What we've seen so far is that the third dose actually is capable of boosting immunity, and so we get the level of neutralizing antibodies that are comparable to what we observed with 2 injections of the original vaccine against the original virus.
So walk me through this just in layman's terms for, in this case, Canadians who've got the Moderna shot. My mom is one of them. What's the likelihood that's going to happen here? Is it that you've had one shot, you get the second shot, and perhaps at the 12-month mark or whenever you go and get a booster shot, and maybe that booster shot has been tinkered with slightly to adapt for some of these new variants? Am I thinking about that right?
Yeah, I think that's what is likely to happen, is basically that, a year after the vaccination, people will get a third dose of the vaccine to boost immunity. And, this version of course, we have to decide what is this third dose, the composition, but it seems that, likely that a version that has, the old sequence of the vaccine and the new one will be part of the new composition. And this data, that we are just obtaining, support the fact that this third dose is going to be able to elicit an immunity that can protect from these variants.
I want to talk to you about mixing vaccines because it's something that we're talking about quite a bit in Canada right now. We have approved and are using the AstraZeneca. It's been deemed safe here for use in Canada. And yet there is still some hesitancy, of course, around the blood clot issue. There is talk, and we look about sort of the vaccine orders that are coming into Canada, a lot more Pfizer, BioNTech, some Moderna, but our AstraZeneca orders are just declining over time. That's how things had been essentially planned. And given that, there is possible consideration being given to the idea of using, say, a Moderna after someone's used an AstraZeneca as their first shot. Any thoughts on that? Any research on that?
Yeah, I think so. For combination or using two different vaccines and vaccine technology is something that has to be tested in the clinic, and so we don't have data at this point on how an AstraZeneca vaccine first dose and then second dose of, let's say, Moderna or Pfizer would work. And those data, I think, are required before such different regimens would be possible to use. Mm-hmm. But it seems something that is potentially feasible. But I think we need, again, clinical data to support it.
How long would something like that take to have that kind of clinical data?
I think there are studies ongoing in maybe in UK, mm-hmm. and so I think in a couple of months, a few months, I would say we might be able to have those data. Yeah.
Have a clearer sense of around efficacy. Now, Mr. Carfi, I know you work on the research side. Lots of talk with Moderna and the supply side. I know that's not your area of expertise, but I wonder if you have, just because you're inside the company, a sense of whether that supply line is a bit more stable around the production.
Yeah, as you mentioned, I'm not in the manufacturing side, but I know that really there is a huge effort in scaling up and being able to provide more doses. I mean, we have recently announced that our target for 2021 is now up to 800 million doses, and hopefully 8 billion doses. And for the next year, we are trying to scale up to 3 billion doses. And some of the investments that are being made are actually in Europe, is where we actually generate the vaccine for the market outside of the United States. Mm-hmm. So I think of course scaling up and generation of vaccine for millions and millions of people is not an easy task, but I think we are really getting there.
Can I ask you a question that is completely different, and it's more just because of what you do for a living? You're originally from Italy. We know what happened in Italy in the first wave and how awful things were there. When you speak with your extended family in Italy and they know that you work on the Moderna COVID vaccine, what are the kinds of things that people back home say to you?
Well, I think, first of all, let me say that actually, yes, as you mentioned, Italy has been hit by the pandemic, and actually was a wake-up call. I mean, really, when the virus moved from China to Italy initially, it's really when I realized, how serious it was going to be. But yeah, I have a lot of friends and family in Italy, and they all, amazed about, what Moderna is doing and the fact that I'm, working with Moderna. So people are very curious. Of course, that they would like to have, more information, but generally very proud about the work that has been done.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.